Welcome back to Atrium After Hours.
Hours.
We are definitely after hours.
Yeah.
Literally.
And we're here with Dr. Sara Lemin, who is one of the OBGYNs at our practice. She is not only a board certified OBGYN, but she is also certified in both obesity medication and care and in menopause care. NAM certified. That means you're pretty legit.
She's
Big
legit.
ones, yep.
Yeah. So she's got all these letters behind her name.
So we should listen to her.
Oh yeah.
Yeah.
Well, I hope so.
Because that's the newest trend right now is people like to come up with their own solutions to health problems, but I think we should listen to the people that have multiple letters behind their name.
I love
The right
that.
I
letters.
mean,
Yeah.
yeah.
I love that.
Yeah.
Hayden. So today there's so many things we could talk about when it comes to menopause, but we have to like reel it in a little.
Yeah.
Yes.
We're gonna have to have part 1, 2, 3, 4, 5, you know.
100.
We're gonna have 100 parts.
Yes. So today we thought we'd talk about like what not to do when you think you're in menopause or perimenopause, and maybe what you could do.
So I think there's a couple of really important, just basic points of things you shouldn't do. You kind of touched on already. You should not get your information from social media.
Dr. Google.
Yeah, Dr. Google, Dr. Influencer out there from of any flavor, but it really should be coming from somebody who does have knowledge and experience in women's health, and should be somebody who's gone through some extra training in menopause specifically, because that landscape has changed so much, even in the last 5 years, the last 3 years, and there's not enough doctors out there that are up to speed, because the last 20 some years, 22 years, there's been this big fear around menopause therapy. And so not everybody knows how to prescribe it. Not everybody wants to prescribe it. Not every patient knows that they are even a candidate for it. So really getting your information from somebody who has the correct information and practices evidence-based medicine is the place to start.
Okay. So you should not probably get your hormone therapy from
Row.com or whatever that is.
I don't even know
What
all
is
the
that?
websites.
That's a website you can get like GLP-1 and all these
Yeah,
medications
Yeah,
without
there's a
any
lot
sort of
places
doctor.
popping up now.
That's
And some
kinda
of them
scary.
are, like MIDI Health, for
Yes.
example, is a
Legit.
online
Yeah.
women's health healthcare company. And there's a couple others. Genev is another one that is founded and run by physicians,
Mhm.
and has some solid background to it. But then there's a lot of them out there that just throw up a shingle and say that they're hormone specialists,
Mhm.
and I think a lot of people get taken advantage of
Sure.
because it's easy and it's sexy and it's enticing
Yeah.
to be like, oh, I'm gonna pay cash for this ultra specific custom hormone therapy, and you don't even know if you're getting the right things or whether it's safe or not. So definitely knowing where you're going and who you're talking to is important. Another thing that I tell patients is to not ignore your symptoms. So many women, especially, I think most women know that when you go through menopause, you get hot flashes and night sweats. Most women do. But that's pretty late in the whole perimenopause transition. And if you define menopause as a year after your last natural menstrual cycle, then you've had a lot of years of perimenopause before that, then you could have been having a lot of symptoms, and many women just don't even know that those symptoms are hormone related or are perimenopause. So many people come in talking about brain fog and fatigue and anxiety, depression symptoms, just not feeling like myself. Things you can't really put your finger on, you can't measure with a lab test, you just know you don't feel right. And so for many women, either they recognize that and bring it up to their doctor, but then get swept under the rug because their doctor doesn't know what to do with them, or they just don't even know what's wrong with them, or that there is anything wrong. Right. They just know they don't feel good. And so, not ignoring your symptoms is another, I think, important thing.
But that doesn't mean go and get blood work. because I think that's something that people, they want to latch on to that.
Yeah.
They want to latch on to, I want my hormone levels checked.
Mhm.
Explain why that does nothing for us when we're still having periods. I mean, it might do a little bit, but what tests are worth it and what tests are just not even.
Not helpful.
Yeah.
Yeah, especially in perimenopause, getting my hormones checked
Yes.
is a very frustrating ordeal, because on any given day in the month of a woman's natural cycle, your hormones can be all over the place. I
Mhm.
could check your levels today and it might be 5, and I check it next week and it's 500. And so it's not helpful in terms of helping us decide what you need, what to prescribe. And it really, I like to tell patients that I don't care what your number is, I care what your body's telling me.
Correct.
What are your symptoms?
So,
What's bothering
Yeah,
you?
and we don't say that you're in menopause because of a blood test. We say that you're in menopause retrospectively when you haven't had a period for 12 full months.
Right.
No vaginal bleeding, 12 months. Then we can say, okay,
You made it.
Yeah.
you made it through.
Welcome, you're here.
Welcome to menopause. So it honestly, like, getting your blood work even within that 12 months isn't going to tell you anything, because if you don't know that you're at that 12 months yet, you could at any time have a period.
Yeah.
Yeah. So guess what your
Yeah.
hormones are
Yeah.
doing when throughout your cycle,
Mhm.
when you're having periods and when your body's trying to figure out what it's supposed
What
to
it's
do.
do. Yeah.
They'll spike
Yeah.
and go up and down. So yeah, like she said, you might check them, and so I'll have people say, "Oh, I went to my doctor. They did my blood work. I'm in menopause."
Yeah.
Oh,
There
yeah.
are a few blood tests that can be helpful, like the FSH, the follicle stimulating hormone level, is one that if it's above a certain level, then you can pretty well say that you are in menopause, even if. So it's more helpful for somebody who either had a hysterectomy at a young age
Mhm.
and still has her ovaries but doesn't know where she is on that timeline,
Mhm.
or maybe somebody who's had an ablation,
Mhm.
or has an IUD, some reason why they're not having periods
Mhm.
other than just naturally not having a cycle. So for those women, it can be helpful to kind of identify where they are in the timeline, but in some ways it just really doesn't matter, because we're not going to treat you based on a calendar or based on a blood test. We're going to treat your symptoms.
Okay. So when you're starting to have those symptoms, even if you're in your 30s, you're starting to have these weird symptoms, come in,
Just for a talk.
have a conversation. Okay.
The average age for menopause is around 51 in the
Okay.
United States, and
Okay.
they say that perimenopausal symptoms can start even 10 years before that. So average is 51, but that means some ladies go through menopause at 45.
Yeah.
So 10 years before that is
35.
So,
Right.
if you're starting to, and so many women have changes in their cycles, changes in their lives, for so many reasons. Kids are getting older, lives are changing, jobs are changing, and it can be hard to tease out what's my hormones and what's just life.
Yeah. Right. Exactly.
So coming in to talk to somebody who really knows and can help tease that out is helpful.
Sure. Okay. And you're one of those people.
Okay.
So I'm just looking at my notes here for what we wanted to talk about today. GSM. So that's like a buzzword right now.
Yeah.
People are talking about, painful intercourse, and the vaginal estrogen is a big thing, and we're all about vaginal estrogen all around, right?
Everybody
Spread it out.
Yeah.
So GSM, the genitourinary syndrome of menopause, has now been sort of officially defined as its own syndrome. And it's really, I think, important to realize that so many women never knew that was part of menopause. They always thought that getting pain with sex or low libido, loss of interest in sex, urinary tract infections, vaginal dryness, just daily discomfort. So many people just think that, oh, that's just part of getting older. That's just part of menopause, and I just have to deal with it. Or I just have to wait till I'm done with menopause and then it'll get better. But with GSM in particular, it doesn't start right away with menopause. It's a little bit, it doesn't always. It's a little bit more slow of a process, and it just keeps on going. Hot flashes and night sweats tend to happen early on, and then they kind of fizzle out and get better for most people. But for the vast majority of women, 80 to some percent of women will have symptoms of GSM at some point in their postmenopausal life. And the other thing that people don't realize is that there are very safe, effective treatments in the form of usually vaginal estrogen that are completely safe for anybody to use. So the estrogen that you either put inside the vagina or around the outside gets very minimally absorbed into your bloodstream. It absorbs into the tissues that it needs to treat, and it really helps restore natural elasticity, natural lubrication, blood flow. But it really doesn't get into your bloodstream. So for those people who are nervous about a family history of breast cancer or a history of stroke or blood clot, it really doesn't have an impact on those other medical conditions.
Right.
And can be very safely used for just about everybody.
So it can help with the UTIs, frequent UTIs, pain with intercourse, vaginal dryness, because that tissue without the estrogen, that's the magic hormone that keeps our tissue moist and supple. And now they're marketing estrogen for your face.
Yeah.
So essentially, well,
For skincare.
Yeah, exactly. Well, and I'm in the Botox business, so honestly, like if your face is dry and needing extra care, like if you need a laser and you need Botox and you need all these potions and serums for your face because you're getting older, guess what? Your vagina needs a little help too. So you can just put that estrogen back in there and it helps so that tissue isn't as like thin and it's atrophy, but like thin and just like it'll get micro tears, which is causing the pain and then like some bleeding, discomfort, and you don't want to have sex and like you're getting UTIs all the time. That's not fun.
Right.
So, and most women can use vaginal estrogen very safely, breast cancer survivors included, cancer survivors, heart disease, hypertension, none of those things are contraindicated for the vaginal estrogen. I love that. Okay. So the other thing that gets confusing, I think, and I'm trying to help all the lay people out there that are on the TikTok. You know what? Maybe we should be on the TikTok. Maybe we should be TikTok famous. Maybe you should find somebody like Dr. Lemin on TikTok and she'll maybe could you do a little dance about the vaginal estrogen? But what? Oh, maybe song. Okay,
Yeah, maybe.
She might sing us a little song. What about like the bioidentical? Like this, that's another buzzword that's out there.
It is, and that's one that's been around for a while. That it's kind of got this dual identity that gets very confusing for people. So at the time when it first started being used, most of the prescription options that were available for hormone replacement therapy were synthetic. They were not the same compound as what our bodies make. They were oftentimes higher dose, different strengths, different side effect profiles than what our body naturally makes. We tend to now in the medical field use the term bioidentical to mean just what it sounds like. It is identical to what your body makes. So the structure of the chemical compound of that hormone is exactly the same thing that's getting made by your ovaries. Where the confusion comes in is when women didn't have enough options in prescription form. There were a lot of options you could turn to in compounding hormones, where it wasn't a retail pharmacy, it was a place where they specifically mixed whichever ingredients you wanted into a special formula just for you. And that sounds very appealing. You know, I get my custom hormone formula. And so the words compounded and bioidentical get interchanged.
Okay.
They not really, it shouldn't be.
So really what it comes down to is who's ordering that and exactly what they're ordering to be in your specific bioidentical or compounded hormone therapy.
Yeah, but many of the prescription options that are available through your regular pharmacy, they're covered by your insurance, are bioidentical, meaning you go to the store, you pick up your prescription bottle of estrogen pills or a patch or whatever you're getting, or your progesterone or your testosterone, and it is the exact same molecule.
Yeah.
As what you were getting.
Okay. So that helps.
So I guess the point of that, or the benefit to that is you don't have to go to a specialty pharmacy to get bioidentical
Yeah.
hormones.
And your
Your
insurance
insurance
covers
will cover
it.
it. They're
might
generic.
cover it.
They're cheap.
Yeah.
They're readily available.
Yes, I know. I know personally, my vaginal estrogen is like $12.
Yeah.
$12, my friends.
$12.
And you can do it like preventatively
Yeah.
before you're that far in. You know, when I started doing exams and looking, doing speculum exams and within my training and doing pap tests and seeing younger women and older women, obviously we see a lot of vaginas.
Yeah.
So when I'm a labor and delivery nurse, I've been a labor and delivery nurse for a long time. I'm not used to seeing menopausal vaginas. That's usually not where the babies are coming out of.
Yeah.
So, well, you never know.
Yeah.
Usually. So when I'm in my training and I'm doing all these speculum exams, I started seeing, postmenopausal women. Of course, that's part of a GYN practice. And they need their pap tests and they need their exams every year, and you're looking and they're getting infections and this and that or whatever. And I started looking at this atrophied tissue, and I was like, I got scared.
Mm-hmm.
And I came out one day, and Dr. Lemin was out there, and I was like,
"What's gonna happen to me?"
I was like, I'm scared. I was like,
I remember that day. You were like, "That's gonna happen to me."
I don't want my vagina to look like that.
Yeah, I remember that
please.
exact day.
Lord help me.
And you definitely don't want it to feel like
No. So everything was fine. Everything is fine. Everything's fine. But everything is fine. But yeah, so doing the research and really reading, like, okay, so this is something I can do preventatively just because I am postmenopausal. I can do this preventatively so that I can avoid that atrophy, avoid the pain, avoid the urinary tract infections, which is what I'm doing, and so far so good.
Yeah.
But so that's great, and I learned so much just training and doing that, and I think that women need to know that they can come early on and say, hey, okay, I'm in menopause, or I'm in perimenopause, or I had a hysterectomy. Should I start doing some vaginal estrogen to prevent that atrophy, prevent the thinning of the tissue, prevent the pain and all of the issues that come along with that? So that's and you can just ask that at your yearly, like, hey, how are things looking down there?
Yeah.
Like if you, I mean, it's never fun, to have a speculum exam, but if it's so painful and you can't even get that speculum in there, and you are struggling with that, maybe you could put a little estrogen back in there. Look what you have to look forward to, Hayden.
I know. I can't wait.
Doesn't that sound fun? Okay, let's see. What else do we need to talk about? So, what about FDA approved versus off label?
Yeah. So, as with anything in medicine, there are very specific, when a new drug is coming out and it goes through its clinical trials, there are very specific criteria that it is studied for, and then very specific indications that it is approved for. But all across medicine, GYN, cardiology, family medicine, all of the time, there are medications that are used for things other than what they are necessarily FDA approved for. And hormone therapy is no different. The hormone replacement therapy like estrogen and progesterone have been FDA approved for the treatment of hot flashes and night sweats. But pretty much anybody else, any woman you talk to can tell you that there's a lot more that goes into perimenopausal symptoms than that. So if you come in and you say, well, no, I'm not having hot flashes and night sweats, my period's a little wonky and my brain fog is out of control, I can't come up with the words that I want to say. My husband told me that I asked him the same question 3 times, and I have no recollection of that.
Blame it on the hormones.
I forgot this kid's appointment. I didn't pack the lunch. Whatever it is. Or just I'm more anxious now. I'm not sleeping well.
The sleep issues. Yeah.
Sleep is a big one.
Yeah.
Just energy and stamina and weight gain, all of those things that hormone therapy is not technically FDA approved for, but we use it off label or not for that exact indication um, frequently.
So they can so people can come when they're in perimenopause. They're still having periods. They're just having some weird symptoms. They just need to bring it up. So it just comes down to communication. And you're not going to have a whole perimenopause visit. You might have to schedule a separate visit because your insurance is not going to cover it. But you get your yearly done and you're like, hey, you know what? I'm going to come back in a month and can we talk about all this other stuff that's going on with me? And then you can try to get to the bottom of it and like work with them to get them on some hormone therapy if they need. I think the other thing that a lot of times happens is people go on antidepressants
for sure
instead, and maybe it's perimenopause or menopause symptoms, and they think that they're depressed, which they have some depression and anxiety because of
the hormones.
Yes, and so if they go to somebody that knows what they're doing, then I think they would have a better outcome. So I think just education, getting your education from the right places, the right people, which is what we're trying to do.
Yeah.
And you touched on another good point. That's the third thing that I always tell people not to do in perimenopause is don't go into your annual exam thinking that you're going to get all of this stuff solved and walk out with your hormone prescriptions and be happy. There's just not enough time.
Yeah.
Perimenopause and menopause are in and of themselves such huge entities that you don't have time to do that. It's not fair to me as the physician, it's not fair to you as the patient to expect that we're going to be able to do that whole process justice.
Well, and also guess what? Your insurance will not cover both of those things in one visit. So that's what it comes down to. It's not that your doctor's, being a jerk. It's that they have 20 minutes to do your annual. So that means, your history, your breast exam, your PAP, your whatever testing, and talk about all the stuff and refill your prescriptions and send you on your way. If you have a problem, it's a separate visit. Just like if you have a UTI or if you have an infection,
you come in for that specific thing.
Correct.
If you're having those symptoms.
Yeah, so you can call and schedule with your GYN and say, hey, perimenopause.
Let's just talk.
Yeah.
Because I feel like
keep your clothes on.
Yeah. I was gonna say because I feel like a lot of women think that their doctor's dismissing them when they bring up menopause, but I think a lot of the time, like you said, there's not enough. If you're scheduled for your annual, you can't just lay that all out on your doctor.
I mean, you can say it hey, I'm having this.
Yeah, but
I'm
then
having these symptoms.
We should go to the next step.
Yeah, and then your physician should say, okay, you know what? I'm gonna have you schedule back in 2 weeks or a month, and you'll get on the schedule, and we'll
and we can just talk.
Focus solely on that.
Yeah,
I mean, it's such a big deal that she has a whole certification for it. I mean, she has special letters and everything.
And I know it. I mean, I'm a busy person. I'm a busy mom. I get that scheduling 2 appointments or 3 appointments
seems like a lot.
It's a lot.
Yeah.
But in the meantime, if you come to me at your annual and we talk a little bit about perimenopause symptoms, I can be like, okay, between now and when you come back in, I want you to go read this book. I want you to go check out this podcast because I think that your symptoms, you would get a lot of answers out of this book. And then when you come back in, you already know more about what your symptoms are, what treatment options are, what your questions are. You've thought about it more. And so it kind of streamlines that second visit too, to where you can do a little homework.
Yeah, you're more knowledgeable about what you're going to be talking about.
It makes the whole conversation easier than having to start from.
Okay, so what book are you having them read, Dr. Lemin?
Well, there's quite a few, but I think that the guidebook is actually
it's under here.
Let's bring it out.
Menopause Society, has this lovely guidebook that is however many pages long, and it goes through all of the basics. It kind of goes through what all the symptoms are, what the hormones are, what treatment options are. And you can just go on menopause.org and order that and have your own copy of it.
Menopause.org, and I'll link it for everybody. So that way you can have, this is legit information that you can read, that you can have at your fingertips, and then you can take some notes and kind of compare what symptoms you're having, and then you can go in and be like, hey, Dr. Levin or whoever you see, I'm having this and this, and I read this book, and it says here, and these are my options, and what do you think?
Yeah.
And then you have a more back and forth,
Yeah.
like equal dialogue about what the patient's feeling, what they know, because I think education is everything. So I love this.
Yeah,
I
it's a
love
good
it.
one. The American College of OBGYN has ACOG.org, has a lot of patient fact sheets and information. And then there's I thought it was the Australian, it's actually the Australasian Menopause Society.
Australasian.
Yes.
Okay.
It's menopause.org.au.
Okay.
Very similar, but I actually like their website better. It's easier to navigate, and their pictures are prettier, I think.
We're all about the
it's just
easy
more-
navigation.
Yeah.
Obviously.
But similar topics.
Okay.
And recommendations and things that, like you said, you can take some notes. You can cancel or just forget about the things that don't apply to you right
Yeah.
now. Like, no, I don't have that. I don't need to worry about this.
Yeah.
I don't have to ask her about that. She doesn't have to spend time talking to me about that. And just kind of streamline that next visit. And then sometimes there are, like, when you leave your annual exam, depending on what we have talked about, I might say, all right, well, I want you to come in for some blood work or whatever. Let's check your insulin level or something before you come back in. And so you can kind of do those things. So we'll have the results back when you come back in. Maybe you need an ultrasound because you have crazy heavy periods and we have to check an ultrasound first.
Yeah.
So there's so many options.
So really getting your information, like, take a break from TikTok.
Yeah.
Take a break and go, like, get this book.
Educate
or
yourself.
Go on the websites that she's talked about, and that's where you're going to get your education from, because the influencers, they don't have, maybe they have education. I don't know. I guess I'm not listening to the influencers, but I'm hearing what people are saying, and so much of it is so off the wall. I'm just like, oh my gosh, where are you guys getting your information from? Which is also one of the reasons why we started this podcast about all things women's health, because I think it's everywhere. They want to listen to the influencers.
People come into your guys' rooms telling you what you should do. And it should be the complete opposite of, even for cosmetic. Like you say, people come in and say, I only want this and this because so and so on TikTok said so.
Right.
That's like that's medical practice. And just like OBGYN, imagine someone going and sitting on in her stirrups and saying,
oh, they do.
You can do this, this, and this.
Oh, they do.
Yeah.
Oh, they do.
But like, she's the doctor.
Exactly.
So we should leave it up to the doctor and the people who have the most knowledge about this.
Right, and she's sending you to legit websites, and there's podcasts that you like. I know that I listen to one that you love. What other ones? Is that your fave?
Yeah, You Are Not Broken.
Love it.
Casperson. She's one of my favorite podcasters. Her book, The Menopause Moment, is one of my favorite books too, for the same reasons that it's just it's well thought out, it's well laid out, but it's the appropriate evidence-based information.
And she's funny.
She's hilarious.
If you listen to this podcast, you'll probably like her.
Yeah.
She says the F word a lot. She's hilarious. She's real, but she's educated. She's a urologist and also like has like certifications in sex medicine or something. Yeah. She is a trip. And she talks about real stuff. Like, she talks a lot about sex and like I started listening to the podcast, and it's pretty funny.
Yeah.
But I listened to like a bunch of them. She has probably 400 episodes. So you can scroll through and find, like, if you're looking for something. I listened to one the other day that was very interesting about muscle and cognition, which we know muscle mass in bone density and with all the people on the GLP-1s. But I was really interested in, why it's so important in menopause to be doing like strength training and how your muscle mass directly affects your cognition, like down the road as you're older. And I'm like, oh God, I better lift some weights so that I can keep my smarts up here. But a couple of them I was listening to, like, I think this was like a few months ago. I come into work, I was listening to a couple, and this chick was talking about, she's talking about, well, now she has her own vibrator out,
Oh.
and she's like certified in sex
Yeah.
medicine, and she's a urologist. So she's funny, and she does it in a funny way and an educational
Yeah.
way. But a couple of the episodes were very like all about orgasm this and orgasm that. So I came in, I'm like, Dr. Lemin,
What are you watching?
I said, holy orgasm.
Sending me
I said,
there.
holy orgasmville. Okay. So that's for another episode.
Yeah.
So obviously Dr. Lemin has to come back.
Yeah.
Like a lot of times. Because there's so much. So go listen to, obviously subscribe to this podcast
Yeah.
first.
And listen to this one first, then go to the next podcast.
But
But one of the other things that she said that I want to kind of wrap it around with is that, you mentioned like patients come in with their list of this is what I want you to do.
Yeah.
And you should really flip that around and be like, no, this is what you should do.
Do. Yes.
This is me as
Yeah.
a physician telling you what you should
Yeah.
do.
Mhm.
But really, what I like about Kelly Casperson and so many of the other sort of menopause specialists that are out there now is that our job is really to educate patients
Mhm.
and give them all the options, all of the evidence, and let you as the patient decide, or we decide together.
Yeah.
Because there's no one formula for
Mm-mm.
everybody. There's no, I can't just look at your history on paper and be like, oh, this is what you need.
Yeah. No.
Or this is what you shouldn't do, or this
Right,
is what you're not allowed
And just because
to
your
do.
sister or your best friend, oh well, my friend got this testosterone. She got those pellets, and then she got this, and you know what? She feels great, and I want that.
Well, that's
Yeah.
might be something you don't need.
No, you probably don't.
Yeah.
So okay. Well, thank you
Absolutely.
so much for coming on and putting up with us.
And we'll have another one.
Yes.
with
All
you.
Okay.
Here for it.
All right. We'll see you after hours.